special guest. For those of you who have never met a midwife, she is a unicorn. This is my cousin, Monifa Dukes. How are you, cousin?
Hello, everyone. Hey, cuz, how you doing? Good to see you.
Same here. You are a unicorn because a lot of times we don't meet midwives,
Right.
you know. And I just want to jump in. I know we have a really important topic, but I want people to know about, why did you choose to go into midwifery? What drew you to this career?
Okay. So, I went to midwifery. I started out as a labor and delivery nurse, and I saw how many women, as a labor and delivery nurse, needed someone there for them. The
Hmm.
nurse was mainly there caring for the woman, and the doctors would come in just to catch the baby and they would leave. And so you needed someone there more for support, to be an advocate for them and stuff like that. And so that's one of the main reasons why I became a midwife.
Oh, wow. As you're saying that, when I was the greatest the show was supposed to have been, my friend Felicia Shepherd was going to come on because we
Mhm.
have the same experience. We were both were high risk pregnancies. My pregnancy, during my fifth month, I was hospitalized
Mhm.
because I had an incompetent cervix.
Mhm.
And for those who don't know, when you have an incompetent cervix, you're at high risk for delivering early. And I had the twins. And I remember just put me upside down and being miserable, and they put magnesium to stop the contractions. And because that's like a muscle relaxer, for those who remember, milk of magnesium, it relaxes the muscles.
Right.
And I remember just being terrified. And then I remember this woman whispering in my ear and saying, "It's okay, I got you." And I looked, and
Yes.
it was a midwife. And I was like, "Oh, who's this?" Because my doctor, OBGYN, wasn't there. And this woman, I kid you not, was constantly there, spoke with my family, walked us through. They had to put a line in my neck. I have horrible, horrible veins. They roll, they collapse. And she was right there with me, talking
Right.
me through it, helping me get through that experience. And because the experience itself was traumatic. I was in the hospital, I think I went in at 4.5 months. I didn't leave until I was, I think, 33 weeks
Wow.
on complete bed rest. Couldn't sit up, couldn't bathe, couldn't leave that bed. That I even had my baby shower in the bed, and it's a trauma. But I never forgot. She was the first midwife I've ever met, and you are the second. I don't
Oh,
meet a lot of midwives. I don't meet
no.
a lot of midwives. Why is that we don't meet a lot of midwives? Because I could have gotten through that trauma without her. Why
I
this?
think I just think the field is not known about, and a lot of people have a perception that midwives only deliver at home. We are not in the hospitals, and we are like I deliver only in the hospital, and but I also do women care. People think midwives is just for women while they are pregnant, but I take care of women before they are pregnant. I help them to get pregnant, so preconception counseling, and afterwards I help women all the way to menopause. And I think that it's just not talked about, or a lot of people, it's just a lack of knowledge about midwives these days.
But it's more of a relational experience. I think that's what I remember about the experience is people kept coming into the room to put the line in my neck, and she was there. People kept coming in the room talking about, well, we can't save the twins because you're not 5 months and babies aren't viable. And I just remember just crying. And I thought that's why this was such an important conversation. And please interrupt me and tell me about your experiences. But I remember
Yeah.
thinking I didn't know what happened because I went to the doctor because they missed scanning one of the twins' hearts. And that's when they
Right.
said, "You're in labor." And I was in labor. I can't be in labor. I'm going to go to Red Lobster. What are you talking about?
Right.
I had no contractions, no symptoms, nothing. And within 24 hours, I was upside down.
Yes.
Lines in
And
my neck.
that's one of the things I smile, because that was one of the things we do when a woman has an incompetent cervix, which means she has a shorter cervix, what makes it easier for her. The cervix is not strong enough to hold the baby and stuff.
Mm.
So we try to put you in a Trendelenburg position, which means upside down, so the babies will not be putting pressure on your cervix. It's a very frightening.
Yeah.
Being pregnant itself is ordeal. But to have any type of complication, I don't care if they say your iron is low and you're anemic and stuff,
Yes,
it increases your anxiety.
it
And so
does.
as a midwife, it means midwife means being with a woman. That's what it means. And so
Mm,
that's all we are there to, like I said, be an advocate, to support her, to really cause her to embrace who she is also. And a lot of education, because we do not know. We depend on the medical profession we depend on them to know and guide us. But sometimes,
yeah,
I hate to say it, but they don't. So we
yeah,
have to educate. It's all
yeah.
about educating.
Yeah, and I appreciate that. And something that you said, when I got pregnant, all I saw was a big belly. I'm gonna be, getting baby sit on the bus. Not that I drive the bus, but I'm gonna get the special attention. I didn't realize I'm a high achiever and I like being in control, like planning. It was the one time in my life where I felt out of control. I couldn't control what was happening, how it was happening, how I was feeling. Every day was so different for me. But when I got hospitalized, I remember thinking, wow, I really don't have control over this. Only thing I had control of was breathing. And I think there's a whole psychological piece that happens when women have complications due to diabetes or incompetent cervix, or there's a loss. And people don't talk about it. It's like a hushed experience.
Yes.
What if, what do you notice about women who do have these high pregnancies? What are they like emotionally? And does it seem like it's a trauma that happens?
Oh yes, it's a trauma, especially I'm going to talk about repeat pregnancy afterwards. So say if you had a traumatic pregnancy prior, women still go through post-traumatic stress from that previous
Mm,
pregnancy, and that fear is there. And like I said, you just gotta try to let them empower them and let them know everything is big. But it's I think the more you educate a person
yeah.
about what's going to happen, like when I finish with my patient, I tell them the next time I see you is going to be in 2 weeks, and this is what should happen. This, to educate them
Mm,
so they will have an idea and it kind of ease their anxiety. It's a lot of anxiety that goes on also. And you hit it right on the nose, having the lack of control. Also, especially if you are a type of person who have that alpha personality, it really could.
I'm not sure why you said that and looked at me, but I'm just like, but it is a very, and it's interesting because we don't, as women, we don't talk about the trauma part of it, because I know that when I got hospitalized, somebody who was at the same weeks that I was also got hospitalized and lost their child, and it
Mm,
was almost like a hushed experience where we couldn't talk about it. And they kept trying. They kept like, well, when I get pregnant again, I'm going to be real still, and this time I'm going to. And they kept losing baby after baby, and that's traumatizing, and
right.
just even the idea of. And there's another trauma that people also don't talk that happens before the pregnancy. If you just trying and not getting pregnant can be traumatizing. It's just that
Yeah.
disappointment. Because I've had clients who said, "Wow, seeing my cycle come breaks my heart." I said,
Yes.
wow. And then getting pregnant is like, oh, and always wondering, is it going to stick? Is it going to stay? And all that anxiety that comes up. And I love
Yes.
what you said about that education piece helps.
Yes. 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 And that anxiety, I just had a patient, she lost her previous pregnancy and she's pregnant now. And she wants me to draw blood on her every 2 days to see where her pregnancy hormone is. And I had to tell her, I said, sweetheart, just trust your body. You would
Mm,
do it, but you could see the anxiety there. And when you
yeah.
have the anxiety during the pregnancy, it lasts after the pregnancy also. And that's why you start seeing the postpartum depression or postpartum
Uh-huh.
anxiety that takes place.
What does that look like when you see clients who have the traumatic experience, right? That feeling of or something happening or body betrayal, like, wow, I'm having heart palpitations or I have diabetes or I'm going into preterm labor. What does that look like? The anxiety, and what does that postpartum look like?
So the anxiety, well, you could see it. They're not enjoying their pregnancy
Mm,
because they are so anxious and They ramble. They come in. I can't get sleep. They can't sleep. They just worry about baby. They questioning things over and over again.
Mm.
And I tell women, if you have a history of anxiety or depression, you're going to be on an emotional roller coaster anyway during pregnancy. So
Yeah.
let your provider know, because we know hormones has we hormones. A lot of female we are full with hormones, and we'll be on that emotional roller coaster.
Yeah.
Um, and if I see that a young lady has anxiety during her pregnancy, I will, after she have her baby, I will bring her back earlier than 6 weeks. I do not wait to 6 weeks. I bring her back in a week, and we do depression score on them, and
Mm.
to see where they are at, because it's a major change.
Yeah, that's huge. And that is so important because people don't gauge what happens to you afterwards, right? They just go, oh, the baby's here, you should be happy. But they don't realize that you've gone through so much. And even if it's been a perfect pregnancy, you delivered when you were supposed to deliver, there's that other part, right?
Right,
Where you may become anxious, overwhelmed, or depressed. And they don't have the coping skills to deal with that. And sometimes, there's a shame experience where people shame them for not being this happy go lucky mother. And the shame looks like, you got a baby, healthy baby, you should be happy. And they don't realize
right,
hormonally you're like this, right?
right,
Like I was so grateful that, I didn't go all the way. What happened is I got hospitalized, and a friend of mine taught me this great coping skill, and she had lost all her babies. She went all the way to 8 months, and or it's like her service kept opening up, like 8 months, 7 months. And she said, Candace, if you take some breaths and have a calendar, focus on getting through every one day at a time, and notice that your body can do this. And I kept
right,
keeping the calendar. She said, write letters to the babies that are coming, breathe, calm yourself down. And
right,
the moment that I did get up, I had I was maybe I was 8.5 months pregnant, and I had lost. I mean, there's so many things that happened. My face got paralyzed during the pregnancies. I had Bell palsy.
that's palsy.
Yeah, Bell palsy. Then I had to relearn how to walk because my legs were weak for not walking for 4 months. And then
Right,
when I went home, I was home for a day and I went to full labor. And by then they were like, we can't stop it. And I remember giving birth to the twins and them going to NICU. So there was like another trauma, like, oh my God. Right. And it's interesting. My friend who's going to be maybe on part two, Felicia Shepard, we talked about it. And there's that period where you give birth and it's like, ah, they're here. But then it's like, oh my God, but they're not supposed to be here.
right,
There's that experience. Right.
right,
And I think that if a provider had just checked me, she would have seen that I was very overwhelmed, very depressed.
right,
Because there were so many losses that had happened back to back to back. And I didn't have time to slow down. I had to go into, I got a pump. I got to go visit them at NICU. And do you see that a lot where mothers just go into go mode and don't?
yes, yes, for sure. Um, and as women, we wear so many hats also too.
Yes.
If we already a mother, we got that hat that we have to take care of the ones that's already at home. Then we have the ones that's premature. If we're a wife, we still have our wife hat that we put on
Yep.
and stuff. So we have so many hats that adds more on to us.
Absolutely.
But we try to stay, as women, we know we always try to stay strong,
Hmm.
and we have to learn, and that's a lot of us. We have to learn to be to talk about it. The and
Yeah.
today I just told the young lady, I said, I commend you for coming to me and letting me know how you feel, because we don't do it because it's such a
Yeah.
taboo.
I'm glad you said that because you're right. It is a taboo. And I can remember being in a hospital and crying, and someone said, no, we're not doing that today. Suck it up. And I was
Yes,
like, just, just get through. And there's that part, right, where you want to be strong and you're realizing for everyone else, I've got to keep this face. But one of the things that makes it more complicated, right, makes the trauma more complicated is when you don't talk about it and you don't acknowledge that, wow, I'm having a blessing and a loss at the same time, right?
right,
And you're not recognizing that you're having trauma symptoms, you're having nightmares about what happened to you. If you've lost a child, if you've been hospitalized, just that going through your head, Yeah, and
Right.
that's big. So it's nice that I'm hearing that for you, you really try to gauge your clients about where they're
Yes.
at. And I know that for me, when I meet clients who are pregnant, I'm always gauging, are you having any past thoughts about any past losses? Are you not sleeping? Are you worried a lot? Are you grinding your teeth? Are you
Right.
having flashbacks about something, right? Are you doing doom gloom thoughts constantly? Because it makes you have the contractions. Because it's a lot that happens to women in couples during pregnancy.
Yes. And I'm
Yeah,
glad you said couples because the fathers go through it, the men go through it also too.
absolutely. Can you say more about that? Because we forget about the men, and right, and what,
Yes.
and our world has changed so that you can be a transgendered biological female and be a male and pregnant. So let's talk about what happens with the men who are watching their partners go through this. What happens to them?
Yeah, so the men, once again, they have this we have the status of men being strong, being masculine and
Mhm.
stuff like that. And they don't want to cry, but deep down inside, they cannot help. Sometimes they cannot help their loved one, and they the ones that really feel out of control when certain situations happen that way. And we do not look at the men that much. We tend to pay
Mhm.
more attention to the females, but we have to also think about the men too.
Yeah. And that feeling of being powerless. I didn't really think about that, of not being able to really help. And then watching someone go through all of that.
Right,
Yeah. Because
right.
that
Because
in itself,
a man is known as a provider, a supporter.
yeah.
And now, if you have a premature baby who's laying in the incubator, you're unable to touch them when you want to, unable to feed them, they have tubes and stuff on it, they feel powerless.
Yeah. And that's a horrible feeling. And you're right, we don't think about it. We just think about because she's carrying it or that the person's carrying it and they're going through all of that. So a lot of the attention goes on that person. But as I'm thinking about my own experience, is there was a lot of pressure on my husband to make certain decisions, that
Yes,
afterwards I knew about, like the thing in my neck. He, they checked with him, would that be okay? And they talked to him about it. It was like, because Candace is sort of out, she's upset. And he really made the decision, do this, do everything possible, do the cyclage. He was really right there. So when I was going to contractions at 1 o'clock in the morning, they would call him, hey, she's going into contractions, calm her down. And I can only
right.
imagine how that would have him spinning, and then
Yes,
bringing a 1-year-old to come visit me in the hospital. And that's a lot
yes,
that we don't
yes,
think about.
right.
And I can only imagine what that does to marriages. It brings that tension there.
Yes,
Yeah,
yes,
yeah,
yes, yes.
that's
It could be,
huge.
and
But go ahead.
I appreciate when men come to the prenatal visits with the women, because a lot of time women will not tell me what they're going through. It be the men that tell me she's crying, she's worried, her
Mm,
anxiety is up and stuff. She won't say anything, and I get a lot of information.
from the
They,
men. So
the
with that
men,
said, what was that like during COVID?
COVID. It
When
was
men couldn't
powerful.
come into the appointments. What was that like? Because that was a whole different game changer.
Yes,
What was that like for the families, the couples who got
yes,
separated for the first time?
yeah. That COVID was it was I would love to see, and I hope someone would do a research on men and how they were affected during COVID, during the prenatal time of their wife or of their baby and stuff like that, because they were not allowed to come in. Just the women could come in. I don't know if they are able to have the same bond with that baby that they had with their other children just because they weren't there to hear the
Mm,
heartbeats during the prenatal visits and stuff like that.
yeah,
Also,
and that so the woman loses that level of support
COVID,
that's there. Yeah,
the support.
and he gets.
So at my practice, what we did a lot was in FaceTime. So when the mothers came, we would FaceTime the fathers or the family during the visits, so they could feel like they were.
Oh, that's great because that connection is important. That level of support is important. One of the things I want to talk about also is something that my friend asked me. to talk about what happens about the guilt part. Because for a lot of women, there's that guilt that comes with what did I do wrong? Why is this happening to me? And you're smiling. I'm wondering, do you hear that a lot? That guilt, or wondering what did I do wrong, or feeling like it's my fault, or if they've done anything in the past, had any surgeries, whether it's been a termination of a pregnancy or have fibroids removed, there's that guilt, or if you're a smoker, or just wondering what did I do wrong? Do you experience that? Because that's part of the trauma experience.
Yes. Um, all the time. I'm not gonna say all the time, but most of the time. And women, we tend to blame ourselves too, whether it's a
Mm,
miscarriage. Did I do something wrong? That cup of coffee I drunk, what did that cause me to have a miscarriage?
mm,
Diabetes, they will blame themselves with the diabetes. Did I eat too much candy? Where you have a family history of diabetes, so you're more prone to it.
yeah,
Yes, a lot of women feel guilty preterm labor, or if they have a fetal demise and stuff. Women tend to blame themselves a lot. And once again, it's about empowering the women and educating them and letting them know. I try to let my women know if they lose babies early in their pregnancy, one time it has nothing to do with you. It's those zones just didn't up. Nothing
yeah,
that has anything to do with you. A lot of stuff is for our genetics. So we can't help if we have high blood pressure during our pregnancy or diabetes during our pregnancy because our family history of it. So
yeah. I'm glad you said that.
we have to think.
Yeah, I'm glad you said that because that is the number one thing that happens is that guilt, that blame, and we forget that we come with genetics, right? And that the body has a
Yes,
memory. For a lot of people, the same month that memory is that confident cervix is going to happen again sometimes for some women, and they have nothing to do with it. That nothing they did wrong, and that's a huge thing, right? And that's a huge thing.
right. Yes.
Um, for women who, because I know that for me, when my babies were born, they want to take a picture. And I remember saying, no picture. I don't remember this because I'm a therapist. And I know that there are certain memories when you capture them, you never forget it. And I remember thinking, I don't want to remember this. But what's ironic is that my girlfriend who was going to be here, she said, no, I wanted the picture because I never wanted to forget. And I was like, wow. She says, so I looked at that picture every day, and every day I beat myself up, or every day I have regret, or every day I just never wanted to forget this feeling. She said, no more children came after that. And for me was, no, I don't want that to be my first image of them. I want to remember them in pictures when they looked healthier, when they were bigger. Do you find that also that some women move fast, don't want to remember that part? That's a painful part because my kids are like 19, her kids are in their 20s. And when she speaks about it, she goes back to those pictures.
So believe it or not, we encourage it. We encourage those pictures. We say a fetal demise and stuff. We dress the babies up, and I hate to say it, I love doing that part. I love dressing the babies up in the
Mm,
outfit, taking the pictures with the stuffed animals, and
yeah.
making the baby bracelets and making a keepsake. And I tell the mothers when I pass it to them, you open it when you're ready.
Oh, that's
And it's
beautiful.
and it's going to be a time when she will be ready to open it. It may not be this year, and so maybe years later, and she can open it up, and those pictures will be
Oh,
there with all the keepsake of what her baby wore, and
yeah.
bracelets and stuff like that. Yes,
Yeah, and I wish that I had, look, in retrospect, I wish I had taken those pictures so I can, because I'll call my twins the miracle twins, because I could have seen the miracle of them in that moment, right? We make decisions, emotion decisions in the moment, and not realizing another moment's going to come, and you're going to be able to measure who they were and who they've
yeah,
become. And that is huge. And for women who are bedridden or who are having complications, recognizing another season comes that you get through
right,
this one moment at a time, taking one
yeah.
breath at a time, and remembering that it does get better and that it's not your fault. And those are huge takeaways. Anything else? You've been amazing. Anything else that you
Thank
want
you.
to share before we end tonight? Anything else you want to share?
I just want to let women know, you could do it. have faith in yourself, have faith in your body. And sometimes we will hit stumbling blocks, but you use those stumbling blocks as stepping stones to get your goal and reach where you have to. Have faith in yourself. Okay?
Mm,
Yes.
thank you so much. That is such great feedback. And for those who want to reach out to you, is there any way that they can reach? Where do you? Is there people who want you to deliver their babies? Any way they can reach you or find you as a provider?
So I mean, they get my I provide my email address, which is my first name, Monifa, Monifa underscore D underscore 2002 at yahoo.com. I don't mind giving advice if you have questions about different things. I do not mind giving advice on, and it's always good to get a second opinion on stuff too.
Absolutely.
Educate yourself. I tell a lot of patients, educate yourself before you go into that office too.
Absolutely.
Okay.
And for those, thank you for that. And for those who look for emotional support and need a mental health provider, a trauma provider, whether it's yogi, a therapist, a psychologist, visit me at coloroftraumaandhealing.com. We provide trauma healing to people who've been through a lot and who need a
Yes.
lot more support than just a regular therapist can provide. So visit us at color of healing and trauma.com. I'm Candace Dickens. This has been Dope Black Therapist. Thank you, Miss Monifa.
You're so welcome. God bless. Happy holidays, everyone.
Podcast.
All right.